I am the tofu golem. Please enjoy the video.
You start by protecting both of you. Wash hands, put on gloves, and explain the brief action to the person. Once done, confirm the G-tube type and that the patient is positioned upright at about 30 to 45 degrees to reduce aspiration risk. Uncap or unclamp gently and inspect the site for redness or leaks so you can proceed safely. This first check prevents pushing against resistance and tells you whether to continue or pause and call help. You now attach a clean syringe to the tube hub and pull back slowly, allowing air and gastric contents to enter the syringe. This controlled suction vents pressure and prevents sudden regurgitation. As you withdraw, observe the color and volume and note it for documentation because changes can signal issues. If you meet steady resistance, stop, reposition the patient and attempt again. Forcing can cause trauma. When aspirating is complete, leave a small amount of negative pressure to assess ongoing drainage before flushing. Once aspirated, flush the tube with the prescribed amount of water to clear residual material and maintain patency. This also explains why you vented, to relieve pressure and reduce nausea. After flushing, replace the cap or clamp securely and clean the skin. Make sure the patient is comfortable and record the volume and findings. If you encounter pain, persistent resistance, or no flow, stop immediately. Try a gentle warm water flush once, but contact a clinician if the tube remains clogged or the patient worsens.
Thanks for watching. Consider subscribing if we helped you today.